What if researchers could find new treatments for existing diseases for less cost, in less time? For motivated funders like you, that opportunity is now.
The mission of Partnership for Cures is to find new uses in new diseases for existing drugs and other therapies, because this is the fastest, least expensive, and safest way to get better treatments and cures to patients who have a need right now. Funders get involved with Partnership for Cures so that they can make an impact now. They know when they fund a particular project that the outcome is going to be in 2 years or less, and it's going to be a direct and significant impact on some patient population.
For many, it is a race against time, where the research necessary to get from here to there is marked by urgency, where the only option for scientists is the hope that their timetable in search of a breakthrough might be shortened. An opportunity made possible by a targeted grant from Partnership for Cures, an initiative that can offer real hope and a chance at life.
There are things that are on the shelf right now, compounds out there already that may be used for other purposes that can quickly be transformed working toward a new condition.
Andrew suffers from familial dysautonomia, or FD, a degenerative and debilitating condition. FD takes away a normal childhood and dramatically limits life expectancy.
He has been hospitalized over 30 times. His last 2 hospitalizations, one was for 6 months and one was for 3 months. I think that takes a tremendous amount of spirit and strength and fortitude to fight the way he does.
In 2001, with generous donor support, Dr. Barish Rubin and his staff at Fordham University identified the gene that causes FD. A few years later, their work yielded a series of treatments that had immediate and dramatic results for Andrew.
After like a couple weeks, I felt it was gone. All the crisis stopped. And now, because of the new compounds, it doesn't happen nearly as much.
But today, even with treatment, Andrew's devastating symptoms resurface without warning. And Dr. Rubin's work is far from complete, knowing that the philanthropic support from Partnership for Cures can sustain his fight, but only additional funding can bring a more meaningful life to Andrew and his family.
Change what was a life-threatening disease into a chronic manageable disease, and hopefully give these kids the quality of life and the time so that as we continue to find new substances, we can actually find a total cure for their disease.
There are courageous young lives that wait, and families that pray, not only for loved ones suffering from devastating illness, but for those with generous hearts and vision, eager to lend their targeted support for organizations like Partnership for Cures. It's what keeps the wheels of hope in motion before time runs out.
They need something quickly. This is about urgency.
The beauty of Partnership for Cures is, A, you know exactly where your money is going. It's not going to Partnership for Cures. It's going to a specific project within the portfolio of Partnership for Cures. You know who the researcher is, you know how much money the budget costs, you know what the institution is, you know what disease it's fighting, and you know that within 2 years, you'll have an answer whether your donation made a difference in the life of a patient.
Dr. Rubin's impact on Andrew and others with FD is being realized. And in a Philadelphia lab, Dr. David Ticci's pioneering research has delivered miraculous results to those suffering from a rare condition known as autoimmune lymphoproliferative syndrome, or ALPS.
We have one particular patient who is very sick from his ALPS, has been on a number of medications for years, and is frequently sick and in the hospital. So we decided to treat him with rapamycin, and since starting on rapamycin very quickly, he's shown a vast improvement in his clinical response. He's back in school, and his quality of life is greatly improved.
Denied funding from traditional sources, it was a targeted grant from private funders that had an enormous impact.
The standard type of grant funding is typically long-term, and that's typically from government funding. The other type of mission is what pharmaceutical companies do, which is after all the laboratory stuff is done, they focus on performing large clinical trials that take 5, 10, 15, 20 years in a large number of patients. And there's kind of a gap. Physicians, scientists have ideas that they might have a way to treat a disease and they could bring it to patients relatively quickly. There's not that many organizations that kind of fit or mesh or have funding mechanisms for that kind of gap.
It is a carefully defined and unique business rigor that distinguishes Partnership for Cures from other philanthropic organizations.
New drug discovery typically takes between 10 and 20 years and costs $1 billion or more. Repurposing drug discovery takes 2 years or less, typically costs under $200,000, and is immediately available to patients and their physicians for use. One of the things that we do best is bring our researchers together with our funders to sort of humanize the process of medical research so it's not so scary and laboratory-like. It's people working with people to find a solution for patients who need something right now.
So it's a great feeling to know that in a short period of time, you can have an idea as a physician or a scientist. You can take care of children with a rare disease, test that medicine in a lab with a small amount of money, and then bring it to the patients and make the patients start to feel better.
We've already seen that with thalidomide in blood cancers, with rapamycin in the kids' disease ALPS, with tocotrienols and EGCG in the kids' disease FD, and in a number of projects that we have ongoing at Mayo Clinic and Harvard and Stanford right now. The funders of Partnership for Cures tell me all the time that being involved with us gives them a feeling of real active participation in finding something that makes a difference in the world.
There are people who are willing to open up their checkbooks, people willing to make that effort. It is humbling.
And I feel like I have a small, very part in that. And that brings me tremendous joy to know that I have seen people working hard to help find a cure.
Donor support immediately translates into better lives for children.
Your funding goes directly to life-saving research. And please know that your generous donations to Partnership for Cures are already making a difference for young lives in their desperate race against time. They're counting on your help.
You always have to feel like this will be over soon. You don't know when some big breakthrough is going to come.
The most important thing to take away from this message is that there are patients out there that need our help right now. So if funders like you step up and fund these repurposing projects, in the next 2 years, patients can have a real, better treatment or cure that they're not going to get any other way.
I imagine that the FD will just disappear. Live each day as if it's your last. I want to say thank you for helping out and making a difference in a kid's life.